Hi, my name is Kimberly. I'm your vocational rehabilitation advisor. How may I help you?
I want some help in finding a job.
Do you mind introducing yourself?
Oh, sure. My name is Jennifer Perez. It's nice to meet you.
Nice to meet you too. So first I want to explain a little bit about our agency and what we do here, our role and job, before we move forward. So here at our agency, we collaborate with the state and we provide services to people with disabilities. Really, our job is to focus on everyone's goal. The services provided varies with each individual and what each person needs. The same services are not provided for everybody. It really is an individual process. We try to see their barriers and see how we can make them become a possibility. Our services include job placement, college training, vocational training, physical or mental rehabilitation. There's many different possibilities that can pop up, and we just look at those and see how we can service our consumers and match their needs. We try to see placements and see where you can have access. Outside sources will contact me, and we don't actually have any connection with them in the future, though. You'll sign a contract with us before we release you out into the community. Everything here is confidential. All our funds are from the government. So just make sure that everything is discussed here before services are provided. Do you have any questions?
That sounds good. I think you answered a lot of my questions. If I wanted to bring maybe like a friend with me or someone into the room, is that okay if I give permission for that?
Yes, that's fine. Only if you give that permission. But you do have to remember the friend or family member, they can't make a decision for you. This is for your goal. You're the only one that can make these kinds of decisions, not your family or friends.
Well, that's nice to know. Thank you very much.
So now I want to move forward. I need some information from you.
Okay.
So on February 11th, 2012.
Yes, that's the day that I called the office and asked for an appointment.
Okay. So now the date of your birthday, please.
My birthday is January 16th, 1983.
Okay. And your address is 25 in Chicago, 6026, right?
Yes, but I forgot to add the apartment number.
Okay, what's the apartment number?
It's apartment 2B.
Okay. And your phone number is 555-242-1234, right?
Yes, that's my home phone number. But I'd like to give you my cell phone number too, because
Okay,
I
sure.
have that with me always. That phone number is 555-326-5269.
Okay. Thank you. And do you have an email address as well?
Yes, I do. My email address is jenny@hotmail.com.
Okay.
Is email a nice way to communicate with you?
Yes, that's fine. I communicate often using email, so that's actually a better way for me. Also, you can call me, that's fine. I'll be available. Just leave me a voicemail if I'm not here.
That's nice to know. Email is really easy for me because I have my phone with me all the time. So,
Okay. So now I want to ask you, what is your disability?
well, as you can obviously see, I was injured in a car accident and I lost my arm.
So your arm was cut off, correct? At the elbow and below?
It is above my elbow.
Do you have any nerves left in your arms?
I do. I was very fortunate that they were able to retain some of the nerve sensitivity in the remainder of the arm. So I do have some sensitivity.
Okay, it's good to know that. Do you have veins in your arm?
I do have a prosthetic arm. I don't use it very often. It's not very comfortable and it's bulky and it doesn't really help me do anything. It's just kind of there for cosmetic purposes. I don't find that it helps me do anything, so I just leave it at home usually.
Now, is that electric, or is it just your very basic prosthetic?
It's just the basic prosthetic arm. While I was injured, I was still under my employer's health care insurance, and they only covered a very basic prosthesis. I wasn't able to get anything with electronics or anything that could move on its own.
Okay, so with your prosthetic arm, does it have a hand or does it more like a hook?
I've never found that I'm able to use the hook effectively because the arm is just so cumbersome. It's very heavy and it's not very comfortable to wear. So I haven't been able to really effectively use the hook to any benefit.
Okay. Can you just briefly explain the accident? What happened? When was it?
I was working and I worked a late shift and I was driving home from the hospital and someone just ran a red light and just hit the side of my car and my car rolled over and my window had been open and my arm was out the window and it ended up just being, too damaged. They couldn't save my arm. The other car T-boned me. It was a drunk driver.
So I just want to clarify to make sure that I understand what really happened. So you were working a late night shift, right? And you were leaving your place of work to go home and you were exhausted. And another driver hit you. And that led to your car rolling over. And then your arm was outside the window, right? And it had to be amputated or it was cut off on the side?
It was broken in many places. Essentially, it was crushed underneath the car, and they were not able to save the majority of the arm because it was so damaged.
So the doctor amputated your arm, correct?
Yes, the doctors amputated the arm.
Okay. And when did this happen?
This happened about 2 years ago in February.
Okay. So did you go back to work after the accident?
I'm a nurse and I'm left-handed normally, and being that my left hand was amputated, I was not able to perform the duties of a nurse. I'm not able to take care of patients, do any of the physical work that's required of nursing because I need both my arms to do that kind of job. So I was not able to go back to my job.
Did the employer let you go, or did you voluntarily resign from your job?
The employer had to let me go. They did a long-term disability type of claim for me because I was not able to come back into the workplace and perform any type of duties related to the nursing job. So they felt that I was not going to be able to do anything in the department. I used to work in the emergency room. I was an ER nurse for 5 years.
Are you still under the disability claim, or has that discontinued?
That ended, and I was, when I became eligible for Social Security disability, the long-term disability from my employer ended, and the Social Security disability took over.
And what type of insurance do you have right now?
I'm under, it's Medicaid for right now. I think that I'll be able to get Medicare after another year or 2 years. I have to be on Social Security disability for a while before I can get Medicare. So right now I'm on public aid insurance.
That's normally, you have to be on Social Security benefits for 2 years before you can have Medicare take over, so that's normal. Welfare has many restrictions and limits. Maybe, have you ever thought about getting a new prosthetic arm, maybe a newer kind? Maybe a doctor can evaluate your arm. Will you be willing to do that?
I would definitely consider it. The arm I have right now is so uncomfortable and not functioning. So I would love it if I could find something else that would work better, that was lighter and more comfortable. Because what I have now, I just feel like it's just sitting there. I'll never use it. It doesn't work for me at all.
Okay, so we will send you to our doctor, and he'll be able to evaluate your arm, and then he'll send me the report. And then when I receive that report, we can sit down and talk about the results and see if the doctor has provided you with enough information. And if you're satisfied with that, then we can start looking at your income and the Social Security that you receive already. We'll see if we are able to help you with the new arm and provide you with a new prosthetic. I want to make sure that you are able to go back to your everyday life. We want to remove that barrier that you that you live with. We want to see if you can transfer your work skills that you had for nursing and maybe apply that to another type of job. Maybe a nursing case manager or something that has less physical requirements involved. Maybe something that just sets up appointments. Do you think that's possible?
I think that would be a nice way to use my knowledge and familiarity with the emergency room and nursing, and apply those skills to a different kind of job. I really loved working in the hospital. I enjoyed working with the patients and the staff. So if I could work in the same area but not necessarily do the physical work of a nurse, I think that would be a perfect solution. I really miss going into work and seeing the people every day.
Okay, that's good. So you may we're going to try and look at what kind of compensations you need for the workplace.
I really don't know what kind of accommodations are available for a person who has lost their arm or the functioning of an arm, other than getting a prosthesis. Um, Typing is a struggle, but I've gotten much better at one-handed typing. I'm able to keep up. I can type information and emails without a problem. It does take me a little longer than it did before, but I've noticed that it's gotten faster for me. My concern is if I have to type up reports with one hand, if that's going to make me be too slow to be considered for a job in a fast-paced emergency room or hospital. Are there accommodations that can help adapt to that?
We have a variety of different assistants that can help you with the technology, and they'll evaluate you and see what works best for you and the hospital. You don't always have to type, maybe you can talk. We'll just see what kind of technology is available during the time, and you'll be evaluated and have someone helping you out with that. We'll see if the new technology and system is able to accommodate you. If the job is not suitable for you and there's no accommodations, we'll take over. We want to make sure that we are well aware of all the accommodations that are provided for you.
Now, if I meet with this technology person, do I have to pay for any of that? My disability is not a lot every month. My concern is that if I have to pay to meet with these different specialists, I'm not going to be able to afford to do that.
No, you will not have to pay for any of the tests being done. That just helps, all those tests and evaluations helps us provide you with the best job
Do I
possible.
have to pay it back after I get a job?
No, you do not have to pay back anything. Nothing is required to pay back. That's paid by the federal government.
That's nice to know. I would be a little concerned about paying back all of this. It'd be worse than a student loan, I think.
Do you have any medical records that you can provide for me right now?
I couldn't bring them with me. The records from my accident there's a lot of them, and I couldn't afford to pay the doctor to make all the copies and the x-rays. Can I get some time, or is there a way that your office can contact the doctor and ask instead of me?
That's fine. We have a form that you can fill out, and that lets us know that you give permission for us to contact your doctor and get all your records. And that'll help make sure that you're eligible for the services that we provide. If the doctor does not provide me with those files, then I'll contact you and see if we have more time for your medical records to be delivered. And then I'll make an appointment with you and we can start talking about services and benefits that you can gain from the development plan and the individual plan that we have for you. And the IPA. And then I'll help provide you with a new prosthetic, searching for a job, making sure that you're ready and prepared, interviews. and just making sure that you're better prepared to start working.